I want to start with a fear that most people carry quietly, not out loud, not in most conversations, but somewhere underneath the surface of daily life, especially after a certain age, there's a worry that doesn't fully go away. What if I lose my mind? Not just forgetting where you put your keys, but the deeper fear. The fear of not recognizing the people you love, of losing the memories that make you who you are, of becoming dependent in the most complete and intimate way imaginable. Alzheimer's disease sits at the center of that fear for millions of people. And I think one of the reasons it's so frightening is that most people don't really understand it. They know the outcomes. They may have watched someone they loved go through it, but the actual biology, the actual timeline, the actual state of the research, most people are working with a picture that is either incomplete or significantly outdated. And here's why that matters. Because the picture that fear paints, that Alzheimer's is random, inevitable, unstoppable, and has nothing to do with the choices you make, is not what the current science actually shows. Today we're drawing from the National Institute on Aging's Alzheimer's disease fact sheet, one of the most comprehensive and carefully reviewed summaries of what researchers currently understand about this disease. And what that research shows is both honest about the complexity and more hopeful than most people expect. There's a specific finding I want to build toward today. It involves the timeline of Alzheimer's, specifically when the disease actually begins in the brain relative to when symptoms first appear. And it changes everything about how you should think about prevention, early action, and what's actually possible. Stay with me. Let's start with the basics. Because I think a lot of people use the words dementia and Alzheimer's interchangeably, and they're not exactly the same thing. The distinction matters. Dementia is a broad term. It describes the loss of cognitive function, thinking, remembering, reasoning, to a degree that interferes with daily life. Dementia has several different causes and several different forms. Alzheimer's disease is the most common cause of dementia among older adults, but it's not the only one. Other forms include Lewy body dementia, vascular dementia, and frontotemporal disorders. And the research notes something important. It's actually common for people to have what's called mixed dementia, a combination of two or more types occurring simultaneously. This is one of the reasons dementia diagnosis and management can be so complex. The same person may have multiple overlapping processes affecting their brain at the same time. Alzheimer's specifically is a progressive brain disorder. It slowly destroys memory and thinking skills, and eventually, the ability to carry out even basic daily tasks. According to the National Institute on Aging, more than 6 million Americans, most of them age 65 or older, may have Alzheimer's. It is currently the 7th leading cause of death in the United States. Those numbers are significant, and they're worth holding, not to create fear, but to underscore why understanding this disease clearly and why taking brain health seriously matters so much. Now let's talk about what Alzheimer's actually does in the brain, because this is where the science gets specific and where understanding the mechanism changes how you think about the whole disease. The story of Alzheimer's begins more than a century ago. In 1906, a German physician named Dr. Alois Alzheimer examined the brain of a woman who had died after years of unusual cognitive decline. Under the microscope, he found something abnormal: clusters of protein deposits and tangled bundles of fibers woven through the brain tissue. Those deposits and tangles still define the disease that bears his name. We now call them amyloid plaques, abnormal buildups of protein fragments between neurons, and tau tangles, twisted fibers of a protein that, in healthy brains, helps maintain the structure of neurons. In a brain affected by Alzheimer's, these plaques and tangles accumulate, disrupt communication between neurons, and ultimately cause neurons to stop functioning and die. The damage begins in the hippocampus, a region of the brain essential to forming new memories. That's why memory problems are typically among the first symptoms people notice. As the disease progresses, damage spreads to other regions of the brain. Language, reasoning, sensory processing, behavior, personality, all of these become affected as the disease advances through its stages. And this brings me to something that I think is one of the most important and most underappreciated Facts about Alzheimer's. The disease begins in the brain long before any symptoms appear. Let that sit for a moment. Research shows that the biological changes associated with Alzheimer's, the toxic protein buildups, the damage to neurons, may begin a decade or more before a person experiences any noticeable symptoms. By the time someone has memory problems obvious enough to prompt a doctor's visit, the underlying disease process may have been underway for 10 years or longer. This is why the research community is so intensely focused on early detection and prevention. Because the window in which intervention is most meaningful, the period when the trajectory of the disease might be most effectively influenced, may be well before any clinical symptoms appear. And this is why doctors rarely explain this clearly enough. The conversation about Alzheimer's usually begins when symptoms are already present, but the biology of the disease is operating far earlier than that. Understanding this changes the urgency of the conversation about brain health, not as something to think about when problems arise, but as something to invest in consistently, long before any warning signs appear. Now let's talk about the stages of Alzheimer's, because I think understanding the progression clearly, not just in general terms but specifically, helps families know what to look for and what to expect. The mild stage is typically when Alzheimer's is first diagnosed. At this stage, the person experiences greater memory loss and other cognitive difficulties, but can still function in many daily contexts. The challenges might include getting lost in familiar places, having trouble managing finances, repeating questions, taking significantly longer to complete routine tasks, and noticeable changes in personality and behavior. This stage is when intervention, planning, and support systems can be most meaningfully established. In the moderate stage, damage has spread to areas of the brain that control language, reasoning, conscious thought, and sensory processing. Memory loss and confusion worsen. The person may have increasing difficulty recognizing family and friends. Learning new information becomes very difficult. Managing multi-step tasks, something as basic as getting dressed, may require assistance. At this stage, some people experience hallucinations, delusions, or paranoid thinking. Behavior may become harder to predict. In the severe stage, damage is widespread throughout the brain, and brain tissue has shrunk significantly. The person cannot communicate and requires complete care for basic daily activities. Near the end of life, as the body shuts down, the person may be in bed most or all of the time. I share this not to overwhelm you, but because clarity about what Alzheimer's involves is more useful than a vague, generalized fear of it. When families understand the stages, they can plan ahead. They can make financial and legal decisions early. They can address safety concerns proactively. They can build support systems before they're urgently needed rather than in the midst of a crisis. Knowledge, even difficult knowledge, creates options. Now let's talk about causes, because this is an area where the research is both more nuanced and more empowering than most people realize. Here's where most people get it wrong about Alzheimer's. They believe it's primarily genetic, that if it runs in your family, you're likely to get it, and if it doesn't run in your family, you're largely safe. The reality is considerably more complex. In most cases, Alzheimer's does not have a single genetic cause. The research from the National Institute on Aging identifies more than 80 genetic regions associated with Alzheimer's risk. But of all those genetic variants, only 3 specific gene mutations are known to directly cause the disease, and these account for a relatively rare form that typically develops before age 65. This early onset genetically driven form of Alzheimer's, while devastating, represents a small fraction of total Alzheimer's cases. For the vast majority of people, Alzheimer's risk is shaped by a combination of age-related brain changes, multiple genetic influences, environmental factors, and lifestyle factors. No single gene is destiny, and genetics is only one part of a much more complex picture. One genetic factor worth knowing about specifically is a variant called APOE4. This version of the APOE gene is associated with increased Alzheimer's risk and earlier disease onset in certain populations. But having this variant does not mean a person will definitely develop Alzheimer's, and not having it doesn't guarantee protection. It shifts probability, not certainty. The important thing to understand is this. For most people, genetics establishes a background level of risk, but lifestyle and environmental factors play a significant role in whether and when the disease develops. And that means you have more influence over this than the genetics framing suggests. We're now at the part of today's video I've been building toward, and I want to be direct with you. This is the section that matters most. This is why watching to this point was worth your time. Because everything I've said so far, the biology, the stages, the genetics, provides important context. But what the research says about modifiable risk factors and lifestyle is what I believe has the most power to change how you actually live. The National Institute on Aging documents a significant body of research on the relationship between lifestyle factors and Alzheimer's risk. The factors that repeatedly appear in this research are ones we've explored throughout this video series: physical activity, a nutritious diet, social engagement, mentally stimulating activities, management of cardiovascular conditions like high blood pressure, diabetes, and high cholesterol. These are not fringe suggestions. They are the mainstream findings of research funded by the most credible brain health institution in the country. And here's the connection that I want to make as plainly as possible. High blood pressure, heart disease, stroke, diabetes, and obesity are not just cardiovascular concerns. Research suggests they are also risk factors for cognitive decline and Alzheimer's. The brain and the heart share the same blood supply. The same conditions that damage blood vessels throughout the body also damage the small, delicate vessels that supply the brain. Over decades, that vascular damage contributes to the conditions in which Alzheimer's-related changes can develop and progress. What this means practically is that the lifestyle investments we've discussed throughout this series, regular movement, a nutritious diet, managing blood pressure, not smoking, limiting alcohol, are not just protecting your heart or your bones or your physical independence. Research suggests they may also be protecting your brain from the conditions in which Alzheimer's is more likely to develop. You cannot control your age. You cannot rewrite your genetic history, but you can influence the vascular health of your brain. You can reduce inflammation. You can support the conditions that allow your neurons to remain healthy longer. That is not a small thing. That is a profound and ongoing act of self-care. Let's also spend a moment on early signs, because knowing what to watch for, in yourself or in someone you love, is genuinely important. The first symptoms of Alzheimer's vary from person to person. Memory problems are among the most common early signs, but the research also points to other early indicators that people often don't connect to cognitive decline. Difficulty finding words, problems with spatial judgment, misjudging distances or depth, having trouble with familiar routes, impaired reasoning or judgment in situations that used to be manageable. These can all represent early changes in areas of the brain affected by Alzheimer's, even before obvious memory problems appear. There is also a condition called mild cognitive impairment, sometimes abbreviated MCI, which represents a middle stage between normal cognitive aging and dementia. People with MCI have more memory and cognitive problems than expected for their age, but those problems don't yet significantly interfere with daily life. Not everyone with MCI develops Alzheimer's. Some people with MCI remain stable. Some even return to normal cognition. But older adults with MCI are at higher risk for developing Alzheimer's over time, which is precisely why early identification and monitoring matter. If you or someone you love is experiencing cognitive changes that feel different from normal aging, changes that are progressing, that are affecting daily function, that other people are noticing, a conversation with a doctor is the appropriate and important next step. A diagnosis process involves memory testing, blood work, brain imaging, and other evaluations. It can identify whether symptoms are due to Alzheimer's, to another form of dementia, or to something entirely different and potentially treatable, like medication side effects, thyroid problems, vitamin deficiencies, depression, or sleep disorders. Getting a clear picture early creates the most options. It protects the ability to plan, and sometimes it reveals that what felt alarming has a completely addressable explanation. Let's talk about what a diagnosis means, and what the current treatment landscape looks like. There is currently no cure for Alzheimer's disease. I want to be honest about that, because you deserve clarity. However, the treatment picture is not static. The National Institute on Aging notes that medications are emerging to treat the progression of the disease by targeting its underlying causes, specifically the amyloid plaques that are a hallmark of Alzheimer's. These represent a genuinely new category of treatment compared to what was available even a few years ago. There are also medications that may temporarily improve or stabilize memory and thinking skills in some people. And there are treatments for the behavioral and psychological symptoms that accompany Alzheimer's: depression, anxiety, sleep disturbances, agitation, which can meaningfully improve quality of life for people living with the disease and reduce the burden on caregivers. Research is moving faster than it ever has. The NIA funds hundreds of active clinical trials testing new approaches to understanding, diagnosing, treating, and preventing Alzheimer's. And volunteers, both those with Alzheimer's or cognitive impairment and healthy individuals, are needed to make this research possible. If you're interested in contributing to this research, either because you have a personal connection to Alzheimer's or simply because you want to support the effort, the NIA's Alzheimer's Clinical Trials Finder and Alzheimers.gov are resources for finding studies near you. Participation in clinical research is one of the most meaningful things an individual can do to advance the field. I also want to spend a few minutes on caregivers, because if Alzheimer's has touched your life, there's a reasonable chance you are in, or will be in, a caregiving role at some point. Caring for a person with Alzheimer's is one of the most demanding things a human being can do. The physical demands are real, the emotional demands are profound, the financial costs can be significant, and the role often extends for years, through stages of increasing need, through the erosion of the person you knew before the disease, through grief that begins before loss and continues long after. The National Institute on Aging acknowledges this directly, and it offers guidance that I want to pass on clearly. Becoming informed about the disease is the foundation. Understanding the stages, understanding what to expect, understanding the behavioral changes that Alzheimer's can produce. This knowledge reduces the shock of each new development and helps caregivers respond with understanding rather than fear or frustration. Support groups are not optional for caregivers. They are, as the research describes, a critical lifeline for many people in this role. Connecting with others who are navigating the same experience provides practical tips, emotional relief, and the profound comfort of being understood by people who genuinely know what this is like. Many organizations offer both in-person and online support groups, including groups specifically for those supporting someone in early-stage Alzheimer's. Physical activity, adequate sleep, social connection, and respite care, time away from caregiving to recover and recharge, are not luxuries for caregivers. They are necessities. A caregiver who is depleted, isolated, and running on empty cannot provide the quality of care they want to provide, and they cannot sustain the effort over the months and years the role may require. If you are a caregiver, your well-being matters, not just as an instrument for better caregiving. Intrinsically, as a person who is doing something extraordinary and who deserves support in doing it. Let's bring everything together with practical actions. The first is to take cardiovascular health seriously as a brain health investment. High blood pressure, unmanaged diabetes, high cholesterol, these conditions are associated in research with increased Alzheimer's risk. Managing them through a combination of lifestyle and, where appropriate, medication is not just protecting your heart. Research suggests it is protecting your brain. Know your numbers. Have the conversation with your doctor. Take the results seriously. The second is to invest in the lifestyle behaviors that research consistently associates with better cognitive outcomes. Regular physical activity, a nutritious diet emphasizing fruits, vegetables, whole grains, and lean proteins. Social engagement, mentally stimulating activity, not smoking, moderate or no alcohol. These are the modifiable factors the research points to. None of them requires a prescription. All of them are within your control. The third is to talk to your doctor early if you notice cognitive changes, in yourself or someone you love. Not when things feel alarming, when something feels different. Early evaluation creates the most options. It can rule out treatable causes of cognitive symptoms. And if Alzheimer's is identified, starting appropriate care and planning as early as possible protects functioning and quality of life longer. The fourth is to look into clinical trial participation if this topic matters to you personally. The research that will change the trajectory of Alzheimer's requires participants, people willing to contribute their time and health data to science. The NIA's resources can connect you with trials that may be appropriate for your situation, whether or not you have cognitive symptoms. And the fifth, specifically for anyone in a caregiving role, is to take your own health and support needs as seriously as you take the person you're caring for. Find a support group, arrange for respite, maintain your own physical health, reach out for help when you need it. Your sustainability in this role depends on it, and the person you're caring for needs you to last. Here's what I want you to carry with you from today. Alzheimer's is a real, serious, and deeply difficult disease. The research is honest about that. More than 6 million Americans are living with it, and the toll it takes on individuals, families, and caregivers is profound. But the story the research tells is not only a story of loss and limitation, it's also a story of advancing science, of researchers who understand more about this disease today than ever before, and who are moving faster toward better treatments. It's a story of modifiable risk factors, of lifestyle choices that may influence whether and when the disease develops. It's a story of early detection creating more options. And it's a story of care and support for people with the disease and for the families walking alongside them that can meaningfully improve quality of life even when a cure isn't available. You are not powerless in the face of this disease, not entirely. The choices you make about how you live, the consistency with which you move, eat well, manage your cardiovascular health, stay mentally and socially engaged, these are not guarantees. But research suggests they are meaningful. They shift the conditions. They tip the balance toward resilience. And in the face of something as significant as Alzheimer's, every shift toward resilience matters. Knowledge is not just information. It's a form of courage, and you've spent time today building it. Before you go, here's something I want to plant in your mind for our next conversation. We've talked today about the biological changes of Alzheimer's and the lifestyle factors that may influence risk. But there's a dimension of this topic that almost never gets discussed in public health content, and that I think is one of the most important conversations older adults and their families can have. It involves the financial and legal planning that Alzheimer's makes urgently necessary, and that most families delay far too long. The decisions about power of attorney, advance directives, long-term care planning, and financial management that are far easier to make early, before cognitive decline complicates the ability to make them at all. This is not a morbid topic, it's a deeply loving one, and we'll explore it thoughtfully next time. If you want to be there for that conversation, if you want to keep getting honest, clear, research-grounded guidance on the things that matter most as you age, subscribe to this channel. Take good care of yourself, and take good care of the people you love. They need you to be informed. Now you are.